Welcome back to the Business of Government Hour. I'm Michael Keegan, your host, and our guest today is Bryan Sivak, Chief Technology Officer at the U.S. Department of Health and Human Services. So, Bryan, you've mentioned that one of your roles is to really uncover the value of, say, data and people in your institution. And so, in a sense, you have to promote innovation to do that and some innovative ideas. I had a question around your technology strategy, but I really want to get your vision and how you're going to do that. How are you, in your role, doing exactly what you said your mission is, and that is uncover that value that maybe not so accessible now?
So I think you take that in two pieces, right? We'll start with the data piece. So over the last 3 years, as I mentioned, we've spent a lot of time and focused a lot of effort on this idea of data liberation, changing that default setting from closed to open. Been, as I said, very successful. We have a website, healthdata.gov, where we publish essentially a catalog of all of the liberated data sets across the department. And we have over 400 data sets listed there out of, I think, our rough tally of what's available is around 1,000. And we progress, every day in terms of finding out where these additional data sets are and helping people understand that there's value in putting that out there. So that's sort of been the first focus for the first few years. What we're moving into now, I would say, is sort of a second phase where we're trying to think about how we recognize the value that's inherent in that data. Mm-hmm. And so we're really looking at three sort of main areas of effort here. Number one is we'll continue the data liberation efforts, although I think it's going from more of a sort of shotgun-style approach to a sniper rifle approach, right? We'll figure out what the specific data sets are that we need to liberate and work to liberate those, as opposed to the broad call of saying, hey, who's got data, bring it in. The next piece is dissemination, right? So how do we continue to get the data out there in better ways? And I mentioned healthdata.gov. The site is essentially right now a catalog for the data sets that exist within the department. One of the ways of getting data out there in a better way is using what's called a application programming interface, or API. What that does is it allows developers to access data sets programmatically, as opposed to having to download a data set, load it into their program, and then refresh that over time, right? What an API provides is real-time access in machine-readable form and programmatic fashion to the data. So we have, I think, 34 or so data sets that are API enabled right now, and we're constantly trying to figure out which ones are more important and to make those more available via API. So that's sort of the dissemination side. And there are other things we're working on with the platform itself to try to make it more sort of friendly to getting information out there, to having conversations around it, that kind of thing. The third area is what I'm calling data education. In the Department of Health and Human Services, like many other places, we suffer from what I'll call the expert problem. We know this stuff so well, and there's such a massive set of terminology and lingo associated with it that we forget sometimes, I think, that there are lots of people out there who could do interesting things with our assets that don't speak the same language we do. There's a great example that I use all the time. There's a data set that's listed on our website called the National Plan and Provider Enumeration System. When you read the first sentence of the description of that data set on our website, I'll read this out at a conference to a room full of people actually who probably are subject matter experts, and literally 3 people will raise their hands when I ask them if they know what that is, right? Turns out that this is this is not quite an accurate statement, but it's pretty much an accurate statement. This data set is pretty much a list of all of the doctors in the United States with their associated specialties and where they are. Okay? That's a very useful data set.
You wouldn't know it from the title.
You wouldn't know it from the title or the first sentence of the description. And so, I use that all the time because it's a great example of, some of the work that we have to do to translate, I think, these sort of the way we frame things, the way we phrase things into words that other people can understand. So this is the data education piece. So that's, one is sort of democratizing our materials. A second piece to that is actually teaching people how to use the data in better ways. So one of the things we're working on right now is we're talking to an organization called Codecademy, which is an online, relatively new site that teaches people how to code. And what we want to do is create a series of classes that teach people how to utilize the data that we have, give them examples of where it can be used, what some of the fields mean, all of that kind of stuff. And so we're experimenting with different ways of getting that out there. So that's the data side. Then on the people side, and the question is, how do we recognize the value in people? This is tricky, because what this really means is culture change. And culture change is probably the hardest thing that you'll ever attempt to do. It's easy to throw a piece of technology on top of something and hope that it works. It's much, much harder to get people to change. Change is hard. So what we're doing is really approaching this from a somewhat systematic perspective, building a framework of a series of programs that will hopefully get us to this sort of overarching goal. The first layer of this is what I'll call a foundational layer. Mm-hmm. And I'm a big believer in collaboration. I think when you look at the history of innovation, or of disruptive innovation in particular, one of the things that really jumps out is that there are very few, if any, sort of eureka moments, right? Mm-hmm. What tends to happen is that people who have these sort of breakthrough ideas, it's really a culmination of years or decades spent reading and studying different materials, but also having lots of people with different backgrounds and different experiences and different cultures all sort of collectively collaborating on a problem. Tony Hsieh, who's the CEO and founder of Zappos, likes to call this serendipitous collision, right? And so one of the things that I think you can take that phrase serendipitous collision and sort of bake that into the concept of collaboration in general. So one of the things that we're really focused on in this foundational layer is enabling collaboration across the department. And that exists in really two parts. One is the physical. If you walk into an HHS building today and, walk down a hallway and open a door and go into like where people actually work, what you'll see are basically cubes that go to the sky and doors that are shut and nobody wandering around. So the potential for serendipitous collisions are minimized. So one of the things that we're looking at doing is creating actually a physical space called HHS Labs, which think about it like a Silicon Valley style co-working space where, all of the furniture is modular, there are no walls, every surface is writable. And I'm not talking about building some crazy expensive thing out here. I'm talking about, going to IKEA and buying some cheap furniture on wheels that you can push around and it doesn't matter if it gets dinged up, right? We're not talking about building something fancy. We're talking about building something with low barrier to connection. So that's one side of it. Then the other side is what I'll call a virtual collaboration space. So about 6 months ago, we launched a internal collaboration network across the department. We had the secretary announce it to sort of give her validation that this is something that we wanted to do. We've been working to increase adoption and engagement on this. Again, this is, it's hard. It's culture change. But we've seen some pretty remarkable stuff start to happen. People asking questions that would not have normally asked questions, or people at various levels in the department interacting that never would have interacted before. And so these are great things. So that's the foundational layer. On top of that, we want to identify people, the ones of the people who are part of this 90,000, who are ready to be activated, the early adopters, if you will. And so we're launching 2 programs which are focused on this identification. One is called HHS Ignite, which is, think of it like seed funding for startup ideas. And we're just about to roll that out. And then the other program we're calling HHS Fairtrade, which I think the easiest way to think about this is it's like Kickstarter internally. And so what we're looking at trying to do is trying to help connect people who have ideas but need resources to implement those ideas, not necessarily money, but mainly people and skills, right? So let's say I have an idea for a website that could do something to help my mission, but I don't know how to code, I don't know how to design anything, and I don't know how to set up a server, right? But I know that there are people in the department who know how to do those things and probably would be interested in helping me on this mission. And so what we want to do is set up a platform that allows people to put out these ideas, much like Kickstarter, and have other folks say, oh yeah, I know how to code, I'll help you out with this thing. And if they get all of their commitments in place, then you cash in on those commitments and everybody starts working on the problem. So that's the identification layer. On top of that, and believing, again, as I mentioned, that these sort of disruptive innovations come from this collision of ideas, we want to bring external people into the mix as well. And so we have 2 programs there. One is called HHS Entrepreneurs, which is, call it a sort of an entrepreneur in residence program. We have essentially some hand-selected high-risk, high-reward projects that exist across the department. And when I say hand-selected, I mean the secretary will select the things that she thinks are important. And what we then do is bring external people in for a period of a year, no more, no less, to actually work on solving these problems. And that has 2 benefits. One, we get new ideas into the mix that we probably wouldn't have otherwise. Number 2, you have some people that are not necessarily bound by some of the bureaucratic handcuffs that folks on the inside are, and are able to prove that there are better ways of doing things. And so this is sort of injecting new concepts into the mix. The other external area that we focus on is a program called HHS Competes, which is our Prizes and Challenges program. And the idea behind Competes is that basically it leverages the America Competes Act. We've done over 100 challenges in the department, given away millions of dollars for good ideas and good solutions to problems. And we want to continue to do that as well, because that just brings lots of new ideas into the mix. Then the final component is what I consider to be sort of the viral engine of change, if you will. And this is called HHS Innovates. And what this program does is actually recognizes those people in the department who have done something interesting. Not necessarily something that works, right? Or something that has solved a problem. Maybe it's in the process of solving a problem, but have tried to do things in different ways. And, we have this great ceremony. The secretary does pictures with the teams. And these are, teams of people from deep in the organization usually. They get plaques. Everybody gets a small check, but the money is actually the least important part of this, right? It's really the recognition of trying something new and actually sort of being recognized for, taking a chance and taking a risk. And so that's really the framework. And so we believe that if we can, implement these programs and then track, their progress, we will be able to start to affect this idea of culture change across the department.